like, and now you have an actual neuron without even touching their brain. You have a neuron in a test tube, and now you can start checking the integrity of every organ and organelle and genes and proteins and second messengers with every single patient. A neuron in a test tube. Now this is just brand new technique that's going to give us an enormous insight. And you can inject drugs, by the way, and see the effect of each drug on that neuron. And the heterogeneity is amazing. Let me tell you one thing that was already found, totally unexpected. They found that all those neurons in a group of patients with schizophrenia, they turned their skin into neurons, and then they noticed that, as we expected, those neurons have very poor processes and synapses and dendrites and neurite extension, very kind of weak, as we know from schizophrenia research. Then they introduced antipsychotics, a variety of old generation and a variety of all the second generation antipsychotics, one at a time, to see if they would bring the cells back into a healthy looking neuron. None of them worked except one. Anybody wants to guess? You wouldn't guess. I couldn't guess. I was totally floored by the result. L'Occitane. L'Occitane, of all the antipsychotics, it's an old antipsychotic, actually restored the connectivity of the neuron, which is a totally new finding. We couldn't have discovered that ever if it wasn't for a technique like this. So now I'm doing a clinical trial in an open label, giving my patients L'Occitane, even though I've been avoiding it for years, to see if it can help restore their cognitive function, maybe integrity in their brain, and hopefully do an MRI study and look at the brain volume. So these are techniques that are going to revolutionize our psychopharmacology. I know